Hello, this is Keren Diamond, Senior Vice President and Chief Operating Officer for Partners Healthcare at Home, here to offer some thoughts as we celebrate the work we do in home healthcare. It is hard to believe that November has arrived, and with it comes another national celebration of home healthcare. I recall last year at this time that our industry was looking ahead to 2020, anticipating that the year would be highlighted by the change from the PPS Medicare payment, which had been in place for 20 years, to the new PDGM payment model. Home health organizations across the country, including PHH, were busily putting the final touches on PDGM preparations in anticipation of the January 1st, 2020 implementation. Many PHH employees were involved in training, workflow revisions, report creation, and other related activities to ensure as smooth a transition as possible. January 1st finally arrived, and we began the 2-month transition to PDGM. Our implementation plans were working well, and thanks to the hard work by many of you, the transition was proceeding smoothly. We were anxiously awaiting the spring months, which we expected would provide us with our first look at complete data when all our Medicare patients were being paid on the PDGM model. Little did we know, as we ended the PDGM transition period in February, that within weeks, our world would be turned upside down and all our attention would be elsewhere. By mid-March, the coronavirus was surging in Massachusetts, and by the end of the month, most of our office-based employees were working remotely. Our clinicians adapted to the numerous calls to comply with ever-changing infection control precautions and the unique circumstances of applying them in the home setting, including donning and doffing outside in the rain and wind. The hospitals had partially emptied out to make room for the surge in COVID patients that continued growing through April. PHH registered its highest daily census of COVID positive patients in mid-May. As the COVID numbers declined, the hospitals gradually resumed more normal operations, and by the end of June, PHH was back to our pre-COVID referral volume, with recovery and adjusting to the new normal continuing every day. And that brings us to November and the celebration of National Home Care Month. I have participated in many home care celebrations, and each year I set aside time to reflect on the expressions of gratitude from patients, providers, and others who value and benefit from our care. In all my years in home health care, there was never a year that even came close to the experience of a once-in-a-century global pandemic that we experienced this year. I have never been prouder to lead an organization that met the call when it was needed. Whether you were on the front lines caring for patients or behind the scenes, supporting staff by taking referrals, scheduling admissions, assuring that visits were approved by the insurance carrier, verifying that the face-to-face was in place, procuring and distributing PPE, answering phones and reassuring callers, supporting staff so they understood their benefits if they couldn't work, doing whatever it took to keep all our computer equipment working well, or providing management and leadership day after day without a break for weeks on end. You made a significant contribution to our ability to continue caring for patients. Never before have the words, "It takes a village," been truer than in the year 2020. I am recording this video in late October for airing next month, and I have been watching the rise in the COVID numbers in Massachusetts. I hope that this upward trend will stabilize, but if we find ourselves once again facing the challenge of a surging pandemic, I have every confidence that our PHH village will rise to the challenge. As I reflect on this past year, what stands out is the caring that employees of PHH showed to their patients and their colleagues, resilience in the face of challenge, and commitment to our mission. I had the opportunity to read many employee stories about different aspects of the pandemic, from all corners of our organization that express pride, fear, resolution, creativity, selflessness, anxiety, and caring. The words of one of our own nurses that expresses so eloquently the range of emotions we all felt sticks with me as we celebrate what home health care means in this year of 2020. She said, "The duality of feeling great pride in what I do, but knowing how COVID-19 is changing everyone overwhelms me. It is both a blessing and one of the hardest things I have ever experienced." In the words of one of our patients, "You are all loving, caring people who provide excellent service to patients and to the community." As we celebrate home health care this year and also mark PHH's 20th anniversary, I want to offer all our PHH employees sincere gratitude for all you do every day and for all you did during a time that was unprecedented in recent history. Thank you so very much.